Hello, my name is Todd Patterson. I'm CEO of Washington County Hospital and Clinics. Today is April 17th, Friday. I wanted to give you a quick update on some of the things that we're working on at Washington County Hospital in response to the COVID pandemic. Additionally, I wanted to let you know that we have a email address that anyone can send questions about the COVID pandemic, or in particular our hospital's response to that pandemic. That email address is covid@wchc.org. In the beginning of March, we began watching as the COVID pandemic entered the United States, and we took pretty aggressive action as a hospital early on. On March 12th, we stood up what is called our Incident Command Center, which is a multidisciplinary group that is aimed at addressing emergent situations within our hospital. We also started working closely with our local public health as well as our state level public health at that time. On that same date, we started visitor restrictions to our hospital as well as McCready Home. A couple of days later, on March 16th, we began screening patients on the phone as well as before they entered our hospital. On March 17th, the next day, we began suspending elective surgeries, elective procedures. We suspended all of our outreach clinics, and we effectively stopped all of our non-essential medical procedures. On March 18th, after much work and consideration, we established our respiratory triage clinic, which is on the east end of our hospital, which is dedicated to seeing patients that have respiratory symptoms that include COVID-19, but especially at the time we established the RTC is what we call it. We were also looking at patients that had influenza A and B, adult RSV, and strep or bronchitis. On March 24th, and as a result of some legislation at the federal level, we began doing telescreening as well as televisits for patients so that we could continue to reduce the number of individuals that needed to be at our facility. I've had multiple people ask me about our testing numbers and how we are treating patients currently. Since we began starting testing, and we started that really in earnest on March 18th, we've tested 434 individuals at WCHC. Of those individuals, 111 have tested positive for COVID-19. Most of those were instructed to be quarantined at their home. They didn't have severe respiratory distress. Some went directly to our ER, and some have gone to our inpatient unit, and others have been transferred to other facilities. We've also had 317 of those 434 patients that tested negative or tested for some other disease process, and we've got 6 tests that are currently pending. We use 2 labs to do all of our COVID-19 testing, the state hygienic lab and also a commercial lab. When we first began testing in earnest, it was taking sometimes 7 to 10 days to get lab test results, which I know is frustrating for not only our patients, but also our providers as well. With the increase in testing capabilities, not only here and elsewhere, we've been able to reliably get test results between 24 and 48 hours. So that's been a huge improvement. One of the things that we did when we set up the respiratory triage clinic is we began screening patients on the phone, and to get an idea of what sort of symptoms they had and if they were a candidate for the RTC. If they screened or appeared to be having respiratory distress, we added another layer where individuals could also get a telescreen so that a provider could actually visit with them through a televisit and make further determinations about the appropriate level of care they needed. Those levels of care include a visit at family medicine, where we're not seeing respiratory cases at the moment, whether that could be done through a telemedicine visit and simply done basically by conference video, whether they need to be seen in the respiratory triage clinic, and whether or not we could do what we call a quick test, which is a patient pulls up in their car and we can test them in their car. Actually, we ask them to step out of their car to do the test because it can be a bit of a tricky test to perform, and we need people to actually be out of their car to do that. Or we sometimes direct people to the ED depending on the severity of their illness. And I did want to mention that we are still screening patients before they enter any one of our facilities, and are masked and appropriately given protection for not only their benefit but also for our employees' benefit, depending on their symptoms. From a hospital standpoint, we are currently treating patients that have COVID-19, but at the moment, fortunately, we still have sufficient capacity here. Should there be the sort of quote-unquote anticipated surge that many of the hospitals, not only in our area but also on the coast, have been waiting for. In addition, with respect to that surge, we've been on a weekly basis discussing surge capacity with hospitals in adjacent counties, both to our south and east, as well as to our north, in particular the University of Iowa and Mercy, Iowa City, to determine how we would handle various situations should there be a surge in our community, and more to the point, should there be a surge in multiple of our communities. I wanted to let everyone know that there are several resources that we're using on an ongoing basis to really monitor the epidemiological curve, to monitor case counts in various counties, and to paint an overall picture of the spread of the coronavirus across our country. And so the resources we are using, which and there's other resources that we're using too, but these are publicly available and we found them to be very helpful. One of the main resources that we've been using locally is the coronavirus.iowa.gov, which is a state and county level view of the various metrics. It looks at testing, positive cases, deaths, outbreaks, and some other things. It's been a very helpful resource for us. Another resource that we've been looking at is Institute for Health Metrics and Evaluations, which really looks at epidemiological curves, testing data by state, and also can give an idea of the number of beds that are available in the state versus how many are predicted to be needed. And it also looks at when each state's peak is predicted. At the last time I looked, May 5th was the projected peak for Iowa, but it was interesting that many states have already passed their respective peaks. So it's worth checking out if you have interest in that. Another resource that we've been using regularly is the Johns Hopkins Coronavirus Resource Center, which really provides a national level view of what's going on in our country, but also an international view, and you can see what's going on in the multiple other countries in the world. I just wanted to give you a quick update of some of the things we have done and are continuing to do. Our capacity for elective patients is still quite low. We're really focusing most of our effort on responding to the COVID pandemic. However, I would stress that our facilities are safe to be seen in. We are triaging patients that are the most high risk out to our respiratory triage clinic and trying to isolate all of that care in that one specific area. And I really want to urge all of you to do your part as we do our part here as well. And that means continue to practice social distancing when you can, limit unnecessary trips out of your home, wash your hands frequently. Soap and water is really the best. Cover your mouth when you cough or sneeze, and monitor yourself for symptoms like fever, cough, shortness of breath. But also, if you have GI issues, that is one of the presentations we're noticing with COVID-19, as well as things like loss of taste and smell. So we would encourage you, if you have any questions around those, to please call. For my part, I want to personally extend a heartfelt thank you to all the community members, especially the myriad businesses, et cetera, who have donated PPE, that have donated some food, that have donated time, and have really rallied to help support Washington County Hospital and Clinics and McCready Home during a really difficult time. I've been touched by your compassion. I've been not really surprised, but thankful. This is a community that always rises to the occasion in my experience. And so I want to thank you for everything that you've done to help us. Remember, if you have questions about COVID-19, that especially medical questions or things as a hospital that we can help with, covid@wchc.org is the email address. And we will either get those answers back to you soon, or we'll have another video next Friday where I will share the answers to those questions. So thank you, and stay safe and healthy.
More than you expect for your health care. Washington